topic is diabetes mellitus. This topic covers definition, classification, pathogenesis, morphologic features, clinical features, complications. Definition. Diabetes mellitus is a heterogeneous metabolic disorder characterized by common feature of chronic hyperglycemia with disturbance of carbohydrate, fat, and protein metabolism. Classification. Type 1 diabetes mellitus comprises 10% of the total cases. Type 2 diabetes mellitus 80%. Other specific types of diabetes comprises 10% of the cases, which include diseases of the exocrine pancreas like chronic pancreatitis, pancreatic tumors, endocrinopathies, for example, Cushing's syndrome, drug-induced, example, steroids, infections like congenital rubella, cytomegalovirus, genetic syndromes like Down syndrome. 4. Gestational diabetes mellitus, which comprises 4% of the total cases. Pathogenesis. Hyperglycemia may result from reduced insulin secretion, decreased glucose use by the body, increased glucose production. Pathogenesis of type 1 diabetes mellitus is shown here. Genetic susceptibility and environmental factors trigger the autoimmune mechanism which leads to type 1 diabetes mellitus. Genetic susceptibility. Concordance in identical twins 50%. Susceptibility gene on HLA region in chromosomes. Environmental factors like viral infections, experimental induction with chemicals, geographic and seasonal variations, vary bovine milk proteins. Autoimmune factors. Islet cell antibodies, insulitis, CD8 plus T lymphocyte mediated selective destruction of beta cells. Pathogenesis of type 2 diabetes mellitus. Genetic factors give rise to decreased insulin secretion and insulin resistance, which in turn produces hyperglycemia and type 2 diabetes mellitus. Genetic factors. Concordance in identical twins 80%. Both parents diabetic, 50% risk to the child. Decreased insulin secretion, worry amylin, worry glucose toxicity of islets, worry lipotoxicity. insulin resistance, receptor and post-receptor defects, impaired glucose utilization. Constitutional factors like obesity, hypertension, low physical activity gives rise to insulin resistance, which in turn gives rise to hyperglycemia and type 2 diabetes mellitus. Constitutional factors include obesity, hypertension, low physical activity. Morphologic features. Morphologic changes are more distinctive in type 1 diabetes mellitus. These include insulitis, characterized in early stage by lymphocytic or eosinophilic infiltrate in the islets, islet cell mass, progressive depletion of beta cell mass as disease becomes chronic. Amyloidosis. Long-standing cases show deposition of amyloid material around capillaries of islets. Beta cell degranulation observed only in type 1. Clinical features include polyuria, polydipsia, and polyphagia. Complications of diabetes mellitus. These complications can be broadly classified into acute metabolic complications and late systemic complications. Acute metabolic complications include diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic coma, and hypoglycemia. Diabetic ketoacidosis. More common in type 1 diabetes mellitus. Here there is severe insulin deficiency which produces lipolysis of the adipose tissue, which results in increased production of ketone bodies. These ketone bodies are utilized by muscles and other tissue. When the rate of ketogenesis exceeds utilization, ketonemia results, which gives rise to ketonuria. If the urinary excretion of ketone bodies is prevented due to dehydration, systemic metabolic ketoacidosis sets in. Symptoms include nausea, vomiting, fast breathing, confusion, and coma. Most cases recover. Hyperosmolar hyperglycemic non-ketotic coma, more common in type 2 diabetes mellitus. It's caused by severe dehydration resulting from sustained hyperglycemic diuresis. The blood sugar will be extremely high. Thrombotic and bleeding complications due to high viscosity of blood may result. Mortality rate is high. Hypoglycemia occurs more often in type 1 diabetes mellitus. May be due to excessive administration of insulin, missing a meal, etc. produces a permanent brain damage if not treated properly. Now, the late systemic complications, which include atherosclerosis, diabetic microangiopathy, diabetic neuropathy, diabetic nephropathy, diabetic retinopathy, and infections, may develop 15 to 20 years after the onset of diabetes mellitus. Atherosclerosis occurs in both type 1 and type 2. Ill effects of atherosclerosis include early onset of coronary artery disease, silent myocardial infarction, cerebral stroke, gangrene of toes and feet. You see the gangrene, dry gangrene of the toes. Diabetic microangiopathy. Here, there occurs a basement membrane thickening of small blood vessels and capillaries of different organs. For example, kidney, eyes. Similar type of basement membrane-like material deposited in non-vascular tissues such as peripheral nerves, renal tubules, etc. Diabetic neuropathy produces symmetric peripheral neuropathy, which is related to diffuse microangiopathy discussed earlier. Diabetic nephropathy is a very important complication of diabetes mellitus. Morphologic features include 4 types of lesions: diabetic glomerulosclerosis, vascular lesions, diabetic pyelonephritis, tubular lesions. Diabetic glomerulosclerosis. There are 2 types: diffuse glomerulosclerosis and nodular glomerulosclerosis. Diffuse glomerulosclerosis, there is a diffuse involvement of the glomerulus as the name suggests. Nodular glomerulosclerosis is otherwise called Kimmel-Steele-Wilson lesion. 1 or more nodules are seen in a few glomeruli. As these enlarge, they compress the glomerular capillaries, giving rise to renal ischemia, which in turn produces tubular atrophy and interstitial fibrosis, resulting in a small contracted kidney. You can see the diagram of diffuse and nodular glomerulosclerosis. Vascular lesions. Vascular lesions lead to renal ischemia, resulting in tubular atrophy and interstitial fibrosis. Diabetic pyelonephritis. Poorly controlled diabetics are partially susceptible to bacterial infections. These acute infections can turn chronic, giving rise to chronic pyelonephritis. Tubular lesions, which are otherwise called Armani-Epstein lesions. There occurs glycogen deposition in the proximal tubules. May return to normal on control of diabetes. Diabetic retinopathy is a very important cause of blindness. There occurs microangiopathy of the retinal vessels. Other ocular complications of diabetes include cataract, glaucoma. Infections. An enhanced susceptibility to various infections is seen in diabetes mellitus. These infections include tuberculosis, pneumonia, pyelonephritis, otitis, carbuncles, diabetic ulcers. You can see the diagram of carbuncle. Thus, we have seen that both types of diabetes mellitus may develop complications, acute metabolic and late systemic. Diabetic nephropathy encompasses diabetic glomerulosclerosis, vascular lesions, diabetic pyelonephritis, and tubular lesions. Symmetric nephropathy is a neurologic complication of diabetes. Diabetics have enhanced susceptibility to various infections. Thank you.